Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today, Dr. Rohrich talks about the 3 E's of choosing a healthcare provider: experience, expertise, and exceptional results. And now, here's Dr. Rohrich.
In today's healthcare environment, the best doctor for you is one that's well informed, and that really also is a better and more informed consumer, which is you, and that's why I'm doing this. People ask me all the time, why are you as a plastic surgeon doing this? Is because I care. I care about my patients, I care about medicine, and I care about giving back. And it's something I do every day. I'm a physician first before I'm a plastic surgeon. So today I'm going to talk about one of the most common things I hear, not only from my patients, but from my friends, is how do you really get good health care? How do you find the best health care, the best health care provider? And it all starts with finding the best doctor. And that's the source. It's no longer just looking at Google, who, of course, Dr. Google is available 24/7. The problem is he's not even a doctor. He's wrong 50 to 70% of the time. So how do you find best care? Because the primary care doctor is gone. It's uncommon to find someone that will consistently be your doctor for a lifetime like it has been in the past. Because if your insurance plan changes or you move, you lose all that. You lose that perspective, you lose that memory, you lose that ability to find somebody that cares about you. Nobody cares more about you than you. And that's the same for your family. And I see this every day. And the most common question I hear is, how do I find an expert? How do I get to that person? And it is amazing to me. I have patients from all over the world, and no matter what their economic status is, who they are, many still don't have the capability to research adequately to find the best care. For example, I saw a young lady from Australia that had been living in Australia for 5 years. She's originally from Europe, and she went to Thailand to get a chin augmentation, and then to Iran to get a rhinoplasty. And of course, both of them had significant problems. So I just saw her this last week and removed the implant and reshaped her entire nose and allowed her to breathe again. So how do you find that person? Well, there are really 10 things that are important. And the most important thing is find a good doctor, because good doctors know other good doctors, no matter where they are. So if one of my patients calls me and says, I have a friend in New York that needs the best orthopedic surgeon for her knee replacement, I immediately can find out who that is, because I'll call one of my colleagues in New York and find out and ask, David, who is the best knee replacement surgeon in all of New York City? And of course, he'll give me 3 names in a heartbeat, because good doctors know other good doctors. I never refer anybody that I know isn't as good or better than me. That's the key. So how do you find those good doctors? Well, and how do you find that they're truly an expert? I call those the 3 E's. Do they have the experience? Have they been doing this a long time? 10 years or more. And is it their expertise? Are they truly an expert? Do they do this operation 3 to 5 times a week? If you do, a hip replacement or knee replacement or a prostatectomy once or twice or a month, that perhaps doesn't make you an expert. You may be good, but you're not an expert. Like for robotic surgery, for prostate surgery, you probably have to do 500 or so to become a true expert in that. And in rhinoplasty, which is in my field, it also numbers in the hundreds and hundreds. And then can you show exceptional results? And can you talk to their patients? Can you look at their photos? Can you interview them? And then you can go to the review sites and the before and afters. But those are the three things. And then once you've done that, I mean, obviously, the three things, that have carried physicians in the past in being good are what I call the 3 A's and the 3 C's. The 3 C's are they caring? Do they care about you? You can tell in a minute when you talk to the surgeon. Are they compassionate? And are they empathetic to your needs? Or are they just looking at their watch and trying to get out of the room? And then the other are the 3 A's. Are they amicable? Are they available if you have a problem? And are they able to do that? And that goes back to the things about experience, expertise, and the ability to deliver consistent, exceptional results. That is an expert. An expert is someone that can deliver consistent, reproducible, excellent results. Of course, no one's God. None of us are God, so we will have complications. But can you consistently deliver good to excellent results? So what is the 10-point checklist that everybody should look to when you look for an expert, whether it's an orthopedic surgeon, a rheumatologist, or a plastic surgeon? And I'm going to give you this perspective, obviously having been a physician for 30 years, but also as an expert in plastic surgery. So first and foremost, find a surgeon or a physician that's board certified by your specialty group. And that's very, very important. By one of the boards of the American Board of Medical Specialties. That's very important. And in plastic surgery, it would be called the American Board of Plastic Surgery. And these are people that are fully trained to do your procedure. They've completed all the written and oral examinations. They really know, this field. There are so many masquerading quasi-experts, because in America, anybody can call themselves whatever they want after they get their MD degree. That's the amazing thing. So it's really become a buyer beware specialty, but also that goes for almost anything in medicine. So choose somebody that's certified by a specific board of the American Board of Medical Specialties, and that's really, really important. And you can look that up online, and it will serve you well. And it's their website is abms.org. Okay, and then find some references that you can trust. I mean, it's not just online reviews. If you see someone that's got 100 Google reviews with no negatives, that's not a real review. Everybody has some type of positive and some not so great reviews sometimes. So perfect reviews does not mean perfect surgeon. And then, talk to your friends. The internet is a very powerful tool, but not everything on the internet. There's a lot of information on the internet. There's a lot of good information, but then there's also a lot of bad information. So, and then visit the websites. Now remember, everybody's famous on their own website. So when you go to somebody's website, you may think they are amazing, and they may have just finished their training. So be careful about that. So research it. And which are some of the great reviews? Go to some of the review sites. I mean, Google has good review sites, Facebook. Go to some that can be verified, and those can be verified. Some of the other sites that are helpful are Real Self and Plastic Surgery, and there are several others, but those are some of the top ones. And do your research, and just don't trust one review. So, and then look at the physician's website, if they have one. They really should have one in this day and age. And go look at what they do. The fourth thing is when you look at the website, look at their photos or how they manage complications. And the fourth thing is, do they have hospital privileges? Because that indicates they've been vetted by their peers in a hospital committee that shows that if they operate in an outpatient facility, that if they have a problem, they can admit the patient to a hospital. And then, number 5 is, ask the surgeon about their experience. How often do you do this procedure? I mean, how often do you do the mastectomy? How often do you do breast reconstruction? How often do you treat patients, that have migraines? How often do you do this surgery for this specific type of brain tumor? These are all things that you need to know, because the most important determinant of your outcome is the selection of the surgeon. That is so important. I'm going to repeat that. The most important determinant of the outcome in your health care is who you choose as your physician or surgeon. And of course, number 6 is, do they talk to you about all the benefits and risks and complications? I think that's really important. They must be forthcoming, because none of us are perfect. We operate with a scalpel, not a wand. So you really need to understand the risks, the benefits, and the complications. And that's very important, because you only have one shot at doing this often, and your best shot at a procedure or getting things done, especially surgically, are your first time. So, and I see this all the time in facial rejuvenation and rhinoplasty and other things, where patients have come with 2, 3, 4 operations, and then I have to work with literally missing pieces of the puzzle. For example, a patient that came that had 4 rhinoplasties and had nothing left in her nose except silicone. I had to remove the silicone, reconstruct the entire nose, and use her own rib graft. That's not ideal. And then number 7 is staying safe. Where do they operate? Do they operate in an outpatient facility that's accredited, or a hospital? Because that's important, because these are facilities that are able to handle not only normal surgery, but any emergency that you may have in your procedure. So that is a key, important aspect of your procedure. After choosing your surgeon, where do they operate? Is it an accredited hospital or facility? That's important. And then the other most important thing besides the surgeon is the anesthesiologist or the anesthetist. These need to be board-certified anesthesiologists, which are the MDs, or a certified anesthetist, which is a nurse that has completed training in this area. I obviously prefer to use MD anesthesiologists, have done so for over 25 years. However, the key is you need to be concentrating on taking care of the patient, and the anesthesiologist's only job is to make sure they stay safe and their vital signs are stable throughout your procedure. So, after selecting your surgeon and your facility, make sure that your surgeon uses a proper anesthesiologist that's well trained. I will tell you, a great physician, a great surgeon will always choose a great anesthesiologist. I work at the same anesthesiology group every day. They know what I do, I know what they do. And number 9 is, what is your recovery? How long is it going to take for me to get back into the public eye, to get back to work, to exercising? All of these things need to be known preoperatively. In general, it takes 3 to 4 weeks to get back doing things, including exercise, but it varies on the procedure you get. And then number 10 is, always get an additional opinion. If you feel comfortable or click with that physician, whether it's for a medical problem or a surgical problem, I think that's fine, but it's also good to consider getting another opinion. And I think that's the most important thing after you select your surgeon, is you got to feel comfortable with them. And these are all things that you need to talk about in a checklist. So bring a card or put it on your iPhone on your notes, these 10 things, and it will serve you very well going forward, because These 10 things I just discussed with you will make the difference between you having a good, bad, or excellent result. So know before you go is so critical. I cannot overemphasize that. That is such a critical thing. And it's okay to come prepared to actually talk to the surgeon about these are the things I want to discuss with you after you tell them the things that bother you. I think those are always the most important things to do. And, remember, you are your own advocate. You are your best advocate. No one cares more about you than you. So today, to be a more informed you, you have to be a more prepared you. And to be a more prepared you, you have to seek out the best physician for the specific problem you have. That is so critical. I cannot overemphasize that. So, for example, I'm an expert in rhinoplasty, an expert in facial rejuvenation and facial aging. I am a craniofacial surgeon and a hand surgeon, but I have not done either of those in 10 years. So would I do craniofacial surgery or hand surgery today? Absolutely not. I would refer to one of my colleagues that does this every day. That's what you want. You want someone that when you go to the operating room, they can do what they need to do, and they do it effectively, efficiently, and with a great result. And that's what I do when I see a patient that has a nasal deformity. I know what the result will look like before I even start. And that is very comforting not only to the patient, but also to us as physicians, because I don't do anything that I don't do the best in the world that I can do. And I always promise my patients, the one thing is I will never leave the operating room until it looks as great as it can be, or I've done everything that I can to make the result look as perfect as it can be. Then, of course, how you heal is the great determinant of your outcome. The take home here is know before you go. The 3 E's: look for experience, look for expertise, look for exceptional results. The 10 points on the checklist, and always ask. Know before you go. And as we discussed, the most important determinant of your outcome is who you select as your physician, who you select as your surgeon. Know before you go. Remember, MD Source is the source for true Dr. Google information by experienced experts and physicians, because a more informed you is a better you when it comes to healthcare for you and your family.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.